rights. Hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I am your producer, Jeremy Carr, here with our host extraordinaire. Ooh, haven't used that, maybe ever. Heather Pierce. So what's on our agenda for today, Heather?
I'll take it. I'm pretty extra.
Your kids tell me that all the time.
They would. Today we have Blake Madden, and he's the creator of a really amazing healthcare newsletter. It's called Hospitalogy. I have been following or reading, subscribing to this newsletter for several years. It's really a healthcare industry newsletter. It's not like really for, like you, Jeremy. Like you wouldn't read it.
I actually did try reading it once, and I'm like, this is way too technical for me.
It is.
I will admit.
It's for industry people. However, I'm a big Uber fan of Blake, so I actually have I don't know, it feels like kind of a healthcare celebrity to me, which he was like, no, I'm not really that, but I think he is. And so the newsletter itself really focuses on mergers and acquisitions in healthcare strategy, a lot of tech stuff, AI, just really lots of cool stuff happening in the healthcare universe. Where I thought there was a nice kind of crossover is that a lot of what we talk about here are the outcomes of all of that work, right?
Oh, gotcha.
And so that kind of consumer facing part for the people, right? This is a show for the people. It is not for the business people. And so I thought, wow, we could have a really cool conversation taking that perspective and his insights from kind of the business side and mine too, for that matter, and then translating into a conversation that really matters for the people. So that's what we're talking about. We might nerd out a little bit.
There you go.
Not going to lie.
Well, there you go. Here's a conversation for the people with Blake Madden from Hospitalogy.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us Blake Madden, founder and creator of Hospitalogy, which is a newsletter in the healthcare space. I'm going to only share that, and then Blake can tell us the rest. Welcome to the show. So happy to have you today.
Yeah, thanks so much. Glad to be here. I know we were just talking about how we rescheduled a bunch of times, so you finally tracked me down. I'm pretty ethereal guy on the I'm in the basement over here, so it's fun to be here.
Healthcare Uprising always gets their guest, man.
That's right.
We never give up.
Tenacious.
Yes,
I appreciate that.
We are a lot of tenacity. And actually, and I was just saying before we started recording that you started a podcast. You started with a newsletter, which has got an amazing following, which is how I know you, because I have been I've been a devoted follower of Hospitalogy newsletter for quite a few years. So tell us a little bit about what Hospitalogy is about, what your background is, kind of what brought you to develop that. And then we'll also have to touch on what you're doing with the podcast as well.
Of course. Yeah. Thanks for teeing me up. And I'd like to say I do appreciate you enunciating the A in Hospitalogy.
Oh.
I call it it's either or, but a lot of people will misspell it with an O, so OLOGY, which makes sense, because a lot of things are spelled that way.
Right.
But it is hospital, OGY, all one word, for those of you listening. And kind of a weird meandering path to get to where I am today. I graduated from, going way back, graduated from UT Austin back in 2016. I don't know how far back that is for everyone listening, but it's far back for me. And so I've been in healthcare about 10 years. The first 5 or 6 years of that journey was me doing healthcare M&A and consulting and valuation work for a firm called VMG Health. So I got my chops on the pure, cold, hard, financial business side of healthcare. And so I was working across every kind of traditional services vertical. So I valued everything or did strategic work on anything from, home health and hospice agency to a physician practice to, joint venture formation and who owns what, and what's the equity and all those sorts of things. And so basically over that time horizon, I've always enjoyed writing and was a secretary in my fraternity. That's a fun fact. And so I just decided one day, hey, I want to learn more about healthcare. So I am going to just stand up a website. And at the time it was called The Healthy Muse, another fun fact for hospitology lorists out there. And I just started writing for weekly, just for myself, essentially, to learn more about both the like kind of finance and strategy of what's going on in my job, but also like more broadly like innovation and other, policy and other considerations like beyond the narrow scope of like what I'm working on, if that makes sense. And so I wrote that once weekly for about 2 or 3 years. And then COVID happened. And at that point, everybody went online and managed to find my newsletter somehow. And then a firm called Workweek reached out to me shortly thereafter. And you can think of Workweek as, for the healthcare audience, essentially like an MSO, but for B2B creators, if that makes sense.
Okay.
So they helped bring some manpower, bring some capital, and operationalize my newsletter. And so they reached out and said, hey, we're looking for creators and analysts and kind of like the Tony Romos of various industries. So like a former insider taken to outside of, the industry to commentate on the industry. And because we think people follow people, we think that you'll attract a more kind of authentic and senior audience because you know what you're talking about and those sorts of things. And, would you like to join and, try to do this full time? And so I, talked to my wife about it and talked to my dad, who's also been in healthcare for, 30 years. And it was just a very unique opportunity to where there was a lot of upside, and I felt like it was an opportunity I couldn't ignore. And so I started writing Hospitalogy. We rebranded from the Healthy Muse to Hospitalogy in April of 22. And then I started writing Hospitalogy ever since. So about 4 years. And over that time period, it started with the newsletter. And to your point, it has expanded into a much broader kind of, media ecosystem. And so that includes newsletter, podcast, community / like membership platform. And now this is the second year I'm doing an in-person event. So there'll be a summit in the fall. Is November the fall? I think it is. But so it's kind of turned into this like very kind of flywheely type thing to where the newsletter subscribers help generate podcast guests and help find sponsorships, which, and you guys kind of understand that as you
kind of make it all one thing. Yeah, it's all
right.
one thing.
Yeah. So it's been a fun journey. The newsletter itself has hit almost 70,000 subscribers. I think just south of that.
Wow.
So it's up there. I like to. I'm a college football fan, and so I like to equate my audience to like a football stadium. And so like the University of Texas, their football stadium's 100K, a little over 100K. So my goal is to fill up the entire DKR stadium with hospitologists someday. So
there you go.
Yeah, that's my story. I feel like I rambled a little bit, but that's where I'm at today.
I look at my cab driving numbers the same way. I'm at about 64,000 career rides at about average of 2 people per ride. I can fill the biggest stadiums going, man. I can fill those soccer stadiums.
There you go.
You could. Yeah, World Cup coming up in a couple weeks.
Yep.
We all have our goals, don't we? That's awesome. Yeah. I don't remember
Can I ask
exactly.
a quick question, actually?
Oh, yeah.
So is the podcast and everything else also under the Hospitalogy name? Is it all branded the same like that?
Good question. Yeah. So I would say Hospitalogy is kind of like the parent company. And what's interesting about that is hospitals in the name. So people kind of think it's like hospital centric, but it's really like I write about everything from hospitals to like, AI scribing to whatever, like innovation and physician practice and risk bearing entities, like whoever it is, like if it's in healthcare, I'm interested in writing about it. I will say I stay mostly away from kind of life sciences stuff just because that's like a world I don't understand as well, but understand like the role that it plays. But the podcast that just launched is called Claims Denied, a Hospitalogy podcast. So that's kind of how the branding works. But I thought that was a fun name, so I couldn't ignore that calling.
Oh yeah, that's definitely catchy. I think
appreciate it.
That'll get some eyes on it. Yeah.
Healthcare Uprising is great too. I think that's a good name. Fits the kind of spirit of healthcare. So
right, I mean, it's an uprising. We're trying to make sure those claims don't get denied.
There you go. Yeah.
That's our goal.
We went through a number of names getting to the Healthcare Uprising, and once we heard the Healthcare Uprising, we're like, oh, that's good. And now I honestly can't even remember what else we wanted to call it before that.
I was going to ask you what were the other names.
Isn't that
no
weird?
idea. I honestly
Literally
don't even
cannot
remember.
remember even what they were, but that's okay because we landed on the right one. Well, and for the record, the reason that I wanted you to come on this show is because of like this exposure that you have through all of this writing and all of the things that you see in these different companies that I read your newsletters, the AI, the technology. So much about what we talk about on the show is about innovation, right? Which is it's like the spirit of the conversations is like, what are we doing differently, better to improve patient care, right? At the end of the day, it's about the end user. That's us, right? Even we're in the biz, right? Well, Jeremy, not so much. He's our man on the street.
I'm just I'm the nerd in the studio that
Yeah.
makes the content happen.
Love that.
Yes, he is.
with
Yep.
the fantastic voice, by the way.
Yes,
Oh,
that
thank you
also
much, thank you much.
is part of it. That helps.
That's part of what got me on the show instead of just
I'm
behind the
gonna
scenes.
I'm gonna have you start like narrating my newsletters.
Hey, there you go.
Click on this to hear Jeremy's voice.
Sure.
Yeah.
We'll talk after recording.
I know.
All right. Yeah, I'll
I keep telling Jeremy, and I'm like, everybody likes listening to you more than me because you have a better voice. It's okay. I don't
People
care.
keep telling me I should do the go to sleep 2 stuff on
You
YouTube.
should, totally.
Just very quietly read some things for long form.
Yeah, wouldn't that be great? I'd listen to it.
Oh, absolutely. Yeah.
I don't know.
There's something
Jeremy.
there for sure.
I'm around you too much now. I don't think I want to listen to you as I fall asleep.
Yeah, and Heather keeps me too busy. I don't know if I have time for that.
Well, as we completely have digressed, what are we here talking about again?
Oh, yeah, we're recording a podcast, aren't we?
Oh, we are. We are doing that. This is how our conversations go because we like tangent and go down different avenues. But going back to the reason that you're here, so the newsletter, you see lots of different things. Our audience is largely people, consumers, regular humans. I do have a pretty big built-in healthcare industry audience, but we're all patients at the end of the day. So I'm curious from the work that you've been doing and how long now have you had this newsletter? It's what, like 7-8 years?
4 years of the newsletter, 10 years kind of in healthcare.
10 in, okay. So only 4 years for why did I think it was longer? And you even said that, but
it's because I'm everywhere.
Because you are everywhere. It seems like longer, but what have you seen like from and you've had these really great meetings lately, those kind of like intimate kind of private meetings that you've been doing, those events, which I think is really cool. What are you seeing shifting? Like what's big? I mean, we know AI, right? But like getting even more granular. Is it within hospitals? Is it the health systems? Is it just the general tech? Just kind of like, in general, what are you seeing?
Yeah, great question. I feel like healthcare is an interesting industry in the sense that everything can be changing all at once, and then everything seems like it's the same too.
Yeah.
So like the same talking points that have always been there are still there. Like employer costs are rising 8 to 10 to however much percent. Specialty drugs are still expensive. Hospital and health system leaders talk about the 2%, 4% problem where, Medicare only reimburses them 2%, but their costs are rising 4%, and there's labor shortages and inflation and all of these things. I would say a lot of that is still kind of status quo overall. But I will say this year seems to be kind of a calm before the storm year in the sense that, from my perspective, like from the hospital and the health system side, they're doing relatively better than they were over the past, 5 or 6 years, kind of post-pandemic. But what's looming is the one big beautiful bill cuts, right? So the Medicaid cuts and work requirements and all those sorts of things. But then, on the other side of the coin, health insurers are not doing that great economically either. So I feel like that's somewhat unique in 2026 is that both sides, usually it's kind of like a push and pull, but both sides are not necessarily doing well and or there is, preparation for kind of the storm ahead from the hospital side. So I think that's super interesting. More so from like an innovation viewpoint. I think there's a ton of exciting stuff happening, as I'm sure you guys highlight on this show often. AI is obviously top of mind. Adoption has been crazy, like the open evidences of the world and so forth from the provider side is super interesting as well.
Mm-hmm.
Kind of that differentiated approach versus like going to enterprise, right?
Mm-hmm.
I would say on the enterprise side, like table stakes AI today is like all the AI scribing companies, right? So it's the ambient layer. And
Oh,
then,
yeah. Like for
uh,
clinical note taking and
right.
things like that. Yeah.
And then, so like you started with clinical note taking, and then it has slowly evolved into, okay, well, how do we actually like monetize this? And then it flows into kind of like clinical documentation, integrity, and
Mm-hmm.
those sorts of things. And so that has created what I have characterized has become this kind of looming. I've said looming like 4 times now,
A lot of
but
things looming right
looming
now.
AI like
It's
bot war.
ominous times.
Yeah.
Yes,
Yeah,
it
you can
is.
tell I read sci-fi and fantasy. The
There you go.
prophecy, but this kind of creation of this AI bot wars, where it's very easy to abuse those tools and upcode, right? Like maximize your billing, and then on the payer side, they are like arbitrarily downcoding or like increasing denials, or like because of the rise in so-called utilization plus this upcoding dynamic, like have a much higher likelihood to, hey, let's create more narrow networks and those sorts of things. And then all of that happening behind the scenes is affecting the patient and the consumer in the sense that their employers are now spending more on healthcare. And so your premiums are rising, your deductibles are higher. And so, what another really interesting trend I'm seeing kind of emerge in real time is a lot of employer experimentation where they're like, hey, I cannot stomach, 10%. I think some small, medium businesses are seeing upwards of 15 to 20% increases year over year. So, like, what can we do to counteract that, right? And so the large employers are experimenting with a lot of kind of direct contracting things.
Like
Um,
direct primary care
it
or
could be direct primary care. It can also be like kind of narrow network, or like network formation with like a large health system in their city. Um,
oh, okay. That reminds me of like a kind of like a joint venture, right? Like Aetna had with, well, I worked for them, Aetna and Banner. So it's like you're inside the Banner Health System in Phoenix, and like, and that is a narrow network, which a lot of people kind of, side eye the narrow
yeah,
network. It makes
yeah.
them feel like, oh, it's
People don't like the
restricted.
neural network. So
Yeah.
yeah, that's why I'm watching it, just to see how it kind of plays out. Because from what I understand, I think there was experimentation with kind of employers and providers in the past.
Mm-hmm.
Um, but it's kind of like returned in flavor this time. And so one really interesting partnership that happened pretty recently was Northwell Health up in New York. It's a pretty large health system in that area. They just merged with New Vance in New Jersey, so they got a huge footprint up there. They announced a agreement with 32BJ, like the big union up there, which I think is
Mm-hmm.
like 170,000 unionized employees.
Oh, wow.
And so that's a direct relationship, which cuts out the health insurer altogether. And so what Northwell did
Okay.
is they said, hey, we'll take a cut on the commercial insurance, like the employer sponsored insurance,
Mm-hmm.
if you like make us your preferred provider partner, right? And so there are certain like rate cap guarantees, like 5% year over year, and like stuff like that. And so it's a very interesting. That's more large scale, right?
Mm-hmm.
But I think that has been very interesting to see, and I think we might see more of that, especially from the health system side, as they bemoan the denials and the other things from the insurer side.
That's really cool, actually. So the companies
Yeah.
can just basically directly pay the caregiver side for
You're,
that's
It's a
yeah,
lot
basically
of
you're
paying a
rhetoric.
eliminating.
subscription for all their people, and it's basically just skipping right over the insurance.
Yep, and then
Wow.
you
Why
think
didn't we
about
think
that.
about that like
I
30
know.
years ago?
But you have to have volume, right? Like in a certain geography in order to
Right.
do that also. So it's not, but like
That's
thinking
true.
about here in Flagstaff, for example, we have Gore. Like Gore is a huge company. They have a lot that's like a big employer in Flagstaff.
And they're in the
Vera
medical
Health,
world. They make stents for your heart and stuff.
they are
So
healthcare, but like we don't like we have here like Northern Arizona healthcare system. So I could see like Gore because we have so many employees because there's not a lot of employers in Flagstaff, sending them straight to the Northern Arizona healthcare system, which isn't just a hospital anymore. You can get primary care, you can get specialty care, you can go to urgent care, you can do all of those things. So you would even have insurance, and you just send you go get all your care there, and it's a direct plan. like a direct contract with the healthcare system?
Pretty much. I think from the consumer or like the patient side, again, like I'm not as privy to like kind of benefits design and like network design and those sorts
Right.
of things, but I know there's experimentation around like, hey, you've got no deductible or like very minimal copay if you go to these facilities, like that kind of thing. So yeah, again, like I think what you're describing is what a lot of health system leadership and even like large physician practices and things like that. Anybody who has kind of density in a market, and this is obviously more on like the urban side where you're
Sure.
working with employers or like maybe a consortium of like a group captive kind of situation. So like to your point, you have to have like some sort of critical mass, I think, to make this happen. But in general, the employer side is seeing this kind of great unbundling to where like, hey, there's so many kind of third party administrators and other things that can kind of say, hey, we want to target this for this chronic disease population, this, and let's choose this. Or like with the PBM, like, hey, we have more negotiating power now because like of how much that has happened on Capitol Hill and like all of kind of Mark Cuban's comments and these things. So like, give us pass through, transparent cost plus pricing, or like we have more negotiating power than ever before, like those kinds of things. And so I'm not saying existentially that like the health insurance business model is collapsing, but in my opinion, I do think it's fraying at the moment because of these various dynamics. And because in general, I think the national conversation around health insurance has been like pretty poor. Like I think their net promoter scores are like negative or something, right?
They're not
So
good.
so obviously something needs to change.
Yeah.
And I just find that dynamic coupled with what I've already described like very, very fascinating.
Well, I even mentioned like the direct primary care. Like that's kind of a growing area. So even just in our little town of Flagstaff, we have two independent primary care providers that have moved to direct primary care approach, which is basically a membership approach. And I'm seeing this become more and more of a thing. But there's still this idea of like, oh, but I have to have insurance in case some terrible tragic thing happens, right? Um,
Yeah.
and I don't know, maybe not. Like, what if we got to change the dynamic, right? Like,
I don't
so
think it's outside of the realm of possibility that
me
health
neither.
insurance eventually becomes hey, it's like car insurance, like catastrophic stuff, right?
Exactly.
And then everything else, like the employer can pick and choose, like, hey, I've got X% of people that are diabetics. I'm gonna, choose that bundle. And then, oh, by the way, like we've got 15 direct primary care concierge physicians like close by, and they've agreed to this rate, like that kind of stuff. Like, I don't think it's outside of the realm of possibility for that to become the future of like health insurance or like benefits.
That's actually a good point too. Or even health plans that are specific to people with chronic problems. Because I was doing that when I was at Banner. We were looking at it at Banner, like literally health insurance plans that have benefits and structure for diabetics. You could do it for people with end stage renal disease or kidney problems, or like certain specific health conditions where it's because you're using the system so much, right? Because you need like volume of access and multiple doctors, and you have comorbidities and things of that nature. So,
and we've talked about similar things on here before in other episodes, and
yeah, we have.
It's really starting to feel like it's going to be a build your own healthcare in the future. Like the pieces will all be out there, and you have to figure out which ones are the right ones for you and put them together to make your picture of healthcare.
So what you're saying is employers in the future will go to Build-A-Bear and they'll say, I want this part, and I'm going to record your voice, Jeremy, and put it in the bear. And that's going to be my new benefits package.
I've always wanted to be a teddy bear. I think that would be wonderful.
I think you would be. That's consumer focused healthcare, which is what we have all been yelling about for so long. Why is healthcare so not consumer friendly? Like how we pick Netflix or Paramount or Amazon Prime, or I want Shudder because I love horror movies, right? But I hate Lifetime because Lifetime's boring, right? Like now we can pick it and that's what we've wanted for all this time. But to to this date, anyway, even presently, the insurance companies have heavily dictated what our healthcare kind of looks like. So
it is interesting. The streaming example is interesting because there's two sides of the coin, right? Like you're like, okay, I can pick just Netflix, or I can like, go to month, or like just have a subscription while this show is out. But then it's like, gosh, I really want to watch this one thing and it's on Peacock and I have to subscribe to Peacock now to get that, kind of thing. So it's nice because it has unbundled from TV and it is like on demand. So there's been a lot of like awesome consumer forward things. But then if you kind of price out each one of those subscription bundles and like add that up to what was previously like cable TV, right? It's like, what's the actual cost benefit? And I would say like it's better now because there is more choice. But there is like an argument to be made there, right? So I wonder if something similar like could happen in healthcare where, okay, we're seeing a lot of unbundling right now, but then eventually there will be other people or other companies that probably will aggregate again. And then what does that kind of health insurance 2.0 look like? I don't know.
You just described me. I was like, I'm getting rid of DirecTV. It's $250 a month. I'm like, I'm pulling the plug. And now I'm like, oh my God. I'm like, I spend $250 a month now because everybody in my family, well, gotta have Shudder, gotta have Paramount, gotta have this. And I'm like, you guys realize we're back right where we started and what I was trying to stop from happening.
Yeah.
But
So
now you get to watch whatever you want, whenever you want.
I do.
Right.
And
that's an important
that
distinction.
was Blake's point.
Yeah.
And now
that's
I'm adding
really
Apple
the only
TV
difference.
because I have to watch shows on that channel now.
But cable
and
had
movies.
TiVo that you could record stuff.
Yes.
So
Right.
But it is nice though, like because you're also your needs change over time, right? Like I have two kids; they're 12 and 17. I can tell you are in terms of healthcare, right? Like, and I'm an older person now than I was when I was having babies versus now being of a certain age and stage of my life. So things I needed 15 years ago, I don't need today. Things I needed today, I didn't need 15 years ago, even for my children. So I do like the idea of like the Build-A-Bear concept, but at the same time, I don't want to spend as much money as right? Like you're trying to
plus like,
costs too.
and the other part of that, so there's obviously cost and there's choice, but the other part of it that's different than healthcare is just like transparency. Like with a streaming service, exactly, like the information is pretty symmetrical. You know the price and you know exactly the shows you're getting and the upcoming shows and the reviews and all these things. Whereas with healthcare, like if you're an employer, you're not necessarily like savvy enough to know, okay, well, this provider is better than that service provider of this, and those sorts of things. And so that was another interesting comment Cuban made, is he was like, everybody should hire like a chief medical officer for their benefits platform, or like because every company is a healthcare company and you need to like be savvy enough to go toe to toe and understand your contracts and all these things. But in general, like that's a huge problem that we're all aware of in healthcare, right? It's just the lack of transparency, and that creates asymmetric information, which prevents us from creating true kind of consumer marketplaces, right? And so then we are more likely to focus on like our physician to help guide us, and maybe care navigators now and those sorts of folks, but to help guide us through the healthcare system. Like you're gonna pretty much go where your physician tells you to go for an MRI or whatever, right? But what I'm hopeful for and curious about and thinking of a lot is how will AI change consumer behavior over the long term? Because I feel like we've all done this, but we've popped a test result into ChatGPT or whatever, and so that's kind of like the baseline of, hey, I'm starting to understand like my health more and take charge of my health. But also like those AI tools, the same thing can be used to, plug into a ZocDoc type function and find a physician ready that has a, appointment ready next day. Or, maybe there's like a transparency tool within that to show you, hey, actually you don't need to go to that, $3,000 MRI. You can go to this $600 one at the outpatient facility down the street, like those kinds of things. Still probably like somewhat of a ways off from that. Like larger scale. But I do think we start to see some kind of elements of a consumer market in certain pockets of healthcare. Most notably kind of primary care and longevity and direct primary care, like we already kind of talked about. I think that's kind of the first horizon, so to speak, of this consumer market. That's
so you're into policy side too, you said, with your newsletter sometimes. If I'm just going to ask your opinion on something here, we're not going to hold you to nothing. If we do go this way, if we do manage to basically squeeze out the insurance companies to the point that the only thing they're there for is for the really catastrophic stuff, my progressive dream, does that make it easier to get the single payer system, the socialized medicine? Because how easy would it, like, if everyone's paying for their own PCP and, like, you have that basic monthly payment you're making already for those things we're talking about, and then you just you pay a little extra into the fund for everyone to get covered for the catastrophic. I mean, do you think that just might, I'm not asking if anything's going to happen, but do you think that would make it an easier path from where we are now with the insurance companies in the way?
That's an interesting question. I could see there being some sort of financing mechanism in place, to your point, where it's, hey, or there's going to be like all of these certain things that happen or conditions or whatever, certain DRGs, I don't know what it is, are going to be considered like catastrophic, uncontrollable things. And so we will pay or cover these things, and then either like privatize or foster more competition in the rest of it. I don't know how functionally that works, but I just have heard a lot of, chatter around that kind of model. So, it wouldn't surprise me if that's the direction we head, especially like most of the time deductibles are pretty unaffordable now anyway. And that was supposed to be this great kind of like, consumer, like take charge of your healthcare kind of tool. And that's obviously just turned into just, hey, healthcare is like unaffordable now. And what am I paying for anyway? Right. So why don't we just like define things as catastrophic and find some sort of financing vehicle for that. And then maybe there's like a, HSA type instrument that it gets broadly distributed. I don't know. I have no idea how functionally it works, but it would work. But I like the thought experiment. I'm curious if you have any thoughts on that.
Yeah. We're just spitballing here.
I'm trying to wrap my mind around the concept of American healthcare without insurance companies.
Yeah.
It's such an alien landscape in my mind that like I'm literally trying to figure out what that would actually look like.
I don't think they'll ever be gone. And I've said it a few times. I feel like they're just going to take a bigger back seat to healthcare. They'll still play a role. And I think, like, to your point around catastrophic coverage, it's more kind of like that. Like when you think about it, like, for example, sorry, Mom, I'm going to call you out on this one, but you backed my car into my son's truck. Okay.
Brutal.
Two vehicles damaged. Well, the truck is, my son's 17. I'm like, the truck is, although it had no body damage, which was like such a bummer. But I went and got quotes on collision from a collision center. And my car's a 2018 4Runner. And it was like the back corner that was damaged. And I was like, well, that might be worth fixing, right? But my son's truck, it's not. And I'm also not filing a claim for this. It's just not enough. I'd rather just kind of like figure it out cash basis, right? Like it wasn't enough damage to justify filing a claim. So I could see it like working the same way, right? Like this kind of catastrophic approach. It's there like when I go to the hospital, if you're my husband and fall off of a roof and, destroy his left leg. Sure. Although I have a, big ass deductible, which is now feeling pretty catastrophic to me because it's so expensive. I mean, our max out of pocket was $15,000 for our family and we hit it. And so now I owe $15,000. Like
that's a lot of money.
Yeah.
That's a lot of money.
It's
a lot of people declare bankruptcy from stuff like that,
Absolutely.
And most of the time it's uncontrollable.
So like, now I'm like, all right, payment plan, you'll get, $200 a month from me or whatever.
You get to pay for it for the rest of your life.
Basically. Yeah, like school loans, right?
Yeah, that's what it becomes.
We're all just, burying ourselves in financial debt. But I could see that working that way. That would be kind of a nice. I don't know. Now I'm like thinking I had never really thought through this, and that's kind of an interesting, I don't know, potential future alongside all of the AI robots.
Yeah, when
And
we will no longer have jobs.
and it
Yeah,
really
exactly.
is. It all comes down to that claims denied, like you named your podcast. That
Yeah.
if the insurance companies were actually functioning properly and doing what we kind of expect of them to do, we wouldn't even be talking about this stuff. It wouldn't be an issue.
Yeah.
But they're
System.
just, I mean, they deny. This one of the biggest examples of this. I got a college buddy who's an accountant. He works at a desk in an office, works at home a lot. But he's been with this company for years. He's been paying for health insurance the whole time. He goes on a hike one weekend and ends up taking a spill and tearing out his shoulder. He needed like rotator cuff surgery or something ultimately. Like he really injured his shoulder. And his insurance wouldn't cover it because it wasn't work related was the reason they gave him.
I'm still trying to figure out what kind of
Wasn't
policy.
work related.
Because that's
He had
weird.
been
Yeah.
that's the story I got.
Yeah.
He had to get, Cobra insurance or whatever. He had to get like supplemental insurance to cover it. So this insurance he's been paying for through his company for years that he like never uses because he's a healthy guy and he's a guy, so he doesn't really go to the doctor. Finally something happens that he needs coverage and they say they're not going to cover it because it's not work related. He is an accountant that works at a desk. When is he ever going to have a work related?
That sounds like a workman's comp
emergency
policy to me, not health insurance, unless it's some kind of really restrictive health insurance policy,
No, like
which
they wouldn't
it
pay
could
his
be.
medical bills. They wouldn't pay his medical. I don't know if he signed up for the cheap
I have so many
plan or
questions.
something. Like, but
Yeah,
even still,
yeah.
like it doesn't seem like that should ever be a thing.
Yeah.
Yeah.
No.
And then just like I feel like everybody has an experience like that, whether they know somebody, whether they've read about it, and that just creates confusion. It creates anger, and then you tack on the financial aspect of it, and it's like it's a double whammy, and people are going bankrupt and all these things. And all that to say, like it is a functional problem of how the health insurance industry is set up, but there's also a cost problem on the provider side as well, which I feel like they kind of get off the hook a little bit more, just because that patient physician relationship is so powerful, and people have their children at these hospitals and have a lot of goodwill with them, and I genuinely think that everybody's trying to do the right thing, but hey, we got to get our costs under control. Like you got to understand where you have the ability to drill down on certain, supply chain things or labor or whatever it is, and know what the cost of thing is and have better, to your point about accounting, since you brought up your buddy who's an accountant, like more enterprise wide, like accounting, like whole house math across like different service lines and understanding where, there are inefficiencies and those sorts of things. And not just like continuing to ask more on the top and just kind of, having your revenue top line never cover a number of inefficiencies rather than, really thinking those things through. Like I think there's some merit to that side as well. So the problem is everybody likes to kind of point fingers and there's various stakeholders, and it's like, oh, well, this policy is happening, so that's going to result in more money for this side, and that's not fair. And then, oh, this isn't our fault because the insurers deny, and then the insurers are like, well, that's not our fault because the providers are upcoding, like all these things. And it's very easy to kind of get lost in the middle somewhere where like everybody's a little bit right, but also a little bit wrong.
Yeah. Well, without beating a dead horse here, more on the insurance thing, I want to talk a little bit. I want to talk a little bit about like the innovation piece, just because that's really kind of a through line in our show, and I know that's a big part of what you do with Hospitalogy. So, in terms of innovation, outside of like the most obvious thing, which is AI, right? Like AI is everywhere, and I will say, I do feel like AI, when used properly, and Jeremy, I think you've probably said this a number of times too, it can be one of the most useful things in healthcare. Beneficial, right? And we see that a lot with people that come on the show. What are you like, again, from exposure from all the people, the research that you do, the people that you meet? where is a lot of the innovation happening? I mean, we cover women's health a lot on the show, so that's definitely one place, but like women's health still is kind of, its own little special area, corner of the world, as far as I know from knowing some people in the hashtag femtech space. But would love to hear your take on kind of the innovation that's coming. What should we keep our eye on? Like maybe there's something we don't know that's coming. Maybe you got
I
a
don't
feel
know if
for
I
it.
know any more than you do. If you guys are having these conversations too, I will shout out one women's health company, Mateen Ali. He runs this company called Obstetra. Have you heard of them? Um,
No.
I think they do kind of. They might have pivoted since I talked to him, but they do kind of
Okay.
like value based care for kind of episodic pregnancy, like trying to produce the best possible outcome at the lowest
Uh-huh.
possible cost, kind of
I'll
thing.
have to
But
look them up.
yeah, yeah. Let me know if their
I wrote
model
it
has
down.
changed, but
Thank you.
it's Obstetra, I think.
Obstetra.
So
Okay.
yeah, super nice guy. Happy to introduce you.
Yeah.
And haven't talked to him a while though. So, but I will say an area of innovation that I just have a ton of respect for and like want to see change is on the consumer side, like we're talking about. And so I had the opportunity to interview General Medicine, which I don't know if you guys have heard of them, but they're the former PillPack founders turned and
Okay. I
created
know
a new
that name.
company. Yeah,
Yeah.
yeah. So they got acquired by Amazon, and then the founders spun out and formed this company called General Medicine, raised around $30 million, and they're basically trying to work within like the current confines of the system, but like create a delightful consumer experience. So like emphasize like quality and like navigation and on all these things. And I think like the biggest question or problem that companies like that will face or are facing is like how do you monetize and like stay sticky and keep those relationships, right? Because there are so many ingrained interests in healthcare as far as like referral patterns or like network leakage and things like that, right? Um, so I really respect and try to like bring attention to those types of companies. More recently, I've talked to a number of folks who are interested in creating kind of like the personal health record, and I know that's been tried 10,000 times, but the general like kind of underlying growing consensus belief is that somebody at some point will like figure out how to do it, especially with AI now. Like there's going to continue to be attempts at it, and so like somebody will eventually do it, and so policy will follow. And I think that creates like a very very awesome new paradigm in healthcare where if you can have access to your own health record. Now obviously you kind of know the talking points, but like if you have access to your own health record and everything you've ever done on your phone or whatever it's on, and you can like plug it into whatever system, then that creates like a very powerful personal ability to maintain control over your health and create behavior change and things like that. So um, I think those are kind of very very leading edge, very tough to monetize, very tough business, but like parts of the healthcare system I respect. And then the other kind of, I guess, sub industry of like innovation or AI I'm following is just kind of everybody who's building AI tools or whatever it is for physicians, because that's really who I consider as the end users in healthcare are the clinicians and physicians, and then the consumer, right? And I think those two groups are the two most powerful groups in healthcare as far as like purchasing power and behavior change and incentive change and like aggregation of like patient lives and those sorts of things, referral patterns, like stuff like that. So just my
Yeah.
2 cents.
It will, if we can help the physicians perform and deliver care, like I always say, at the top of their license, right? Because right now they're overburdened by all the administrative garbage baloney. If we can help them be better doctors, we have better patients, right? We're healthier. Like
Yeah,
we need
yeah,
to give them so much love and support. I 100% agree with you. If we
And
get that piece right,
yeah,
and then like secondarily to that, like us as like the patients, the consumers, having control over our through the apps and the technology and the things that make it make us proactive, right? And Jeremy, as he was talking, tell me you were not thinking of Guava Health.
Yeah, that first part was definitely Guava Health, the
Oh
tracking
yeah.
your own
There you
healthcare
go.
kind of stuff.
Yep.
And
They're
we
great.
do have a number of episodes with other people on various
Yeah.
topics about empowering the doctors.
Yes. Big. I'm
Yeah.
seeing a big shift in a
Some
lot of
of our
these.
titles are even that. I think we have one called "Empowering the Front Lines of Healthcare" or
Mhm.
something like that. Like,
Cool.
Yes.
we definitely have a handful of episodes with companies that are very specifically trying to make doctors' jobs
Yeah.
easier.
Picasso MD.
There you go. That
That's
was the one I was trying to think of.
Yep. They're that's like a specialist referral in your palm, the palm of your hand. That's for providers.
Cool.
Really cool stuff. The other Wellbe Health is another one. These are all people I've
There you
worked
go.
with, which is really cool because I've been in this industry so long, Blake, that I'm like, you know how it is. Like you just you're inside this, like, I don't know, ecosystem of people.
This-
And
That's
yeah,
why this
Yeah,
is
you
Heather's
find your people.
podcast.
yeah,
I
yeah.
can go, we should talk to somebody about this. And she goes, oh, I know somebody for that.
Oh, I'm
Let me
like,
write that
I
down.
knew
I
something.
love that. That's awesome.
Yeah, it's good. No, there is a lot of good stuff happening. I think I'm glad you mentioned the personal health record. That's a big one because our information has been so disparate, right? Like on all these different platforms, and the technology wasn't there to pull it together. And now it's like we're getting to this place that I can see back. Probably I could look back on my health record back into the early 2000s, maybe, to see who knows how far back, maybe forever. I don't even know. Um, that would be pretty cool, actually. I'd probably be like, oh, I forgot that happened to me.
Yeah. So
Right?
who knows if we, the EHRs let it happen, or if like policy gets passed.
Yeah.
I know I'm not an interoperability expert or anything like that. So I don't
Yeah.
know where the, I'm sure somebody's like screaming at me right now, like, no, that's not possible.
Right.
But I like to dream.
Well,
Anything's
We're-
possible if we try hard enough. How's
that's
that?
right.
Love that.
And as we say in our outro, we say we are not doctors and we do not play one on TV.
Yeah.
We just talk
We're
about
not giving
things.
medical advice. We're just asking questions, man.
That's right.
Love
Yeah.
that. Love that.
Yeah, starting conversations, getting people interested. And I think that's the biggest thing too. And what a great way to kind of wrap up this conversation is that the purpose of our show, I think what you're trying to do, like we're all trying to educate, inform, and empower people with information so that they can figure out what they need, what makes sense for them, what's next, right? Like what's coming. Um, the innovation, the technology with AI, it feels like everything's happening really, really quickly right now. So
Yeah, totally agree. I think that's one of the more interesting points is healthcare is traditionally this very slow moving industry, and like
Mhm.
policy dictates innovation in a lot of circles,
yeah,
and you have to clear it with compliance and all these things. But then on the complete opposite end of the spectrum, you have this new technology that is literally, getting doubly better every 6 months or whatever it is, and
Yeah.
new models are coming out. And so there's this like very poignant tension and friction between those two forces, right? And like
Mhm.
what ends up playing out, like, are we about to have 50 different states regulate AI in 50 different ways? Or are we going to have one federally mandated, like standardized policy? Like, I think a lot of that will dictate how
Yeah.
much change we do see and how quickly.
Yeah. Well,
Didn't the
I'm
federal
here for
government
it.
tell states they can't regulate AI right now? Isn't that a thing?
I want to say, yeah, like they put a moratorium on it
Yeah.
or something.
They literally
like that.
aren't letting anyone regulate AI right now. Yeah.
Yeah, which is crazy. I think that has
Yeah.
to change.
Yeah, a lot of things
Very
have to
good
change.
reasons. Yeah, but here we are.
That's why it's
and-
called an uprising.
Yeah, that's right.
I love that. Love that. There we go.
We're here for
Just tie a bow on it.
Exactly. We're here for the uprising. Well, Blake, with that, thank you for coming on the uprising. This has been great. I have been looking forward to this conversation for many, many months, and always good to have kind of fellow industry nerds on the pod.
Oh, yeah.
So we can nerd out on all the healthcare things, but and hopefully everyone listening gets something from this, right? Like this is, we were maybe talking a little shop here a little bit, but I think there's a lot that came out of this conversation that is actionable. It's going to pick people's interest. Know that there's good work happening for our benefit.
There is. Absolutely.
Totally.
Yeah.
Thanks for having me on. I love riffing about healthcare. That's my full-time job now. And so it's been a ton of fun talking to you guys, and yeah.
Awesome.
times.
Same. Back at you.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!